The purpose of this video is to briefly examine the handicap of hearing loss. A lot of people have difficulty with the term handicap, so I'm using the handicap term lightly, and really what this is about is the impact that hearing loss has on individuals. So let's look at the correct terminology that we need to use when we're describing or discussing the impact. A lot of these terms you're probably familiar with, and you have probably heard or used some of these in some of your classes or when you've worked in the audiology clinic, maybe doing some reports. So the first one, hearing level, refers to the softest sounds that humans can hear. It's based on a very long term study of adults who had normal hearing and no problems with their ears. And this was completed back in the 1940s. So the term hearing level refers to the human's ability to hear. Hearing loss. For some people, when they hear hearing loss, it implies something was lost, like their hearing was lost. But for people who were born with a hearing loss, it doesn't make sense to characterize it as a loss of something that was never there. Older adults don't necessarily mind referring to their problems as hearing loss, but people who were born with a hearing problem often frequently use different terminology. Hearing impairment refers to a partial or total inability to hear. Some people prefer hearing impairment over hearing loss. I personally feel like impairment sounds worse than hearing loss. That could be my clinical profession and my experience in the clinical profession. Some people may prefer impairment over loss. Hearing handicap, and again, I'm using this term lightly, refers to the impact that an individual's hearing loss has on their life. How do they get out? Do they participate? Are they able to attend church or go to plays? So is it affecting what they would do before this happened? And again, that's assuming that an individual had hearing and then lost it. Hard of hearing refers to not able to hear well. And deaf means the ears can't hear at all. So in the deaf community, and we'll look at the deaf community in a couple of weeks, the deaf community prefers these two terms over all of the other ones. So hard of hearing means that you can't hear well, but deaf means you can't hear at all. And they don't make a judgment about when the loss occurred or how much of it is being affected. So those two terms are preferable by the deaf community. Some of the factors that impact an individual, and we've talked about all of these, but these are rated as the most impactful to the least impactful. So if a person has congenital hearing loss or hearing loss that's present at birth, that is the most that's the biggest factor that affects their ability to access the hearing world. People who have acquired hearing loss, on the other hand, have had auditory experience, and it really depends on when in their life that it occurred. So congenital is the biggest impact factor on an individual. The type of hearing loss is also another big impact. People with conductive hearing loss have the ability to access sound through bone conduction. So if they have conductive hearing loss, the outer and middle ears are impaired. But if we can get it loud enough, the sensory neural mechanism, or the inner ear, is fine. So there's no issue there, and they can access hearing through bone conduction. And there are hearing aids that are designed specifically for conductive hearing loss. Sensory neural, on the other hand, is just the opposite. The outer and the middle ear are fine, but the inner ear is not fine. And the inner ear is where all of the sensory information is processed and sent along to the brain. So people with sensory neural hearing loss will have a bigger impact than for people who have a conductive hearing loss. And the other type of loss is a mixed loss. So again, sensory neural has the greatest impact, followed by mixed, because it's a combination of both sensory neural and conductive hearing loss. So the sensory neural part will impact that individual. The conductive part will not. The degree of hearing loss. Really, probably the degree should be flip-flopped or used in conjunction with the type of loss. You can't have a complete loss by a conductive hearing loss, because once you get about 40 or 50 decibels, then the bone conduction mechanism kicks in. So really, the maximum amount of conductive hearing loss that a person can have is about 50 decibels. A person who has severe to profound, and profound sensory neural hearing losses are affected the most by their hearing problems. Individuals with mild and moderate hearing losses that are sensory neural in nature also have some issues, but not the same as severe to profound, and profound. The configuration of a loss plays somewhat into how it affects the individual, but it really depends more on the degree and type of hearing loss. And the last factor is word recognition scores. So word recognition is part of an audiogram. So if you've done audiology clinic, then you've done word recognition scores where you ask a person to repeat back words. They're single syllable words at a level that we think they can hear, and then they get a percentage. And so generally, the higher the word recognition score, the less affected, and the poorer the word recognition score, the worse. But that doesn't take into account that some people are able to read lips really well. So that is the least impactful, and we're, as a profession, looking at different ways to reconfigure how we use that measure in our evaluations. Another thing I failed to mention is the difference in ears affected. So a person with a unilateral hearing loss will not have as much difficulty hearing because they have one ear that's good versus someone who has a bilateral hearing loss or hearing loss in both ears. Unilateral hearing loss is now being referred to as single-sided deafness, and you see that more in the literature now than previously. Okay, so again, the degree of hearing loss, generally speaking, the greater the degree of loss, the greater the handicap. The configuration or the shape of the audiogram helps us to determine the frequencies that are impacted the most. But again, this is dependent on the degree and type of hearing loss that a person has. And again, the word recognition scores are not always a good predictor because they don't take into consideration whether a person has lip reading skills, whether there's any background noise, do they make use of contextual cues and inflection, as well as visual cues. When we do it in the booth, we're measuring under ideal conditions. So again, the test is limiting in that it tells us a person's hearing status, but it can't help us predict ability to access auditory ability with any degree of precision. I've had patients with severe hearing loss who seem to do beautifully in most situations, and I've had individuals with mild hearing loss struggle immensely. So it really is an individual thing that's predicted by all of the factors that we just discussed. So now that we've completed the assessment, what do we do next? We need to determine the impact that the hearing loss is having on that individual. And so there are a couple of tools that we can use to determine the impact that this is having on an individual. Some of the alternatives that help us are these three different forms. So one is the familiar sounds audiogram. You'll see the speech banana, although it's not yellow here. If you look at the one that I've posted on Moodle, it's the yellow speech banana, and what it does is it shows where all of the phonemes occur and other familiar environmental sounds that an individual might experience, like birds, leaves rustling, a baby crying, dogs barking. And so how we use this audiogram is we plot an audiogram on this. And so if a person has hearing within the normal limits, so we're talking about 0 to 15 or maybe even 20, a person should be able to hear all of these sounds. Maybe not a soft leaf rustling, maybe not a soft bird, but they should be able to hear all phonemes and follow normal conversational speech. But if we go even to the 25 line, which is what some people use to determine whether a person has normal hearing or not, you can see that even at 25 decibels, people can be impacted by their ability to pick out these sounds. And the more you get away from that 25 line and you get down to the moderate hearing loss range, these individuals are experiencing difficulty accessing all phonemes and a lot of familiar sounds. When we get down to severe and profound, there's little access. They might be able to hear a lawnmower, or an airplane or a helicopter or motorcycle. It really just depends on the individual. But I use this a lot in the classrooms because, especially for teachers, it's really impactful when they're teaching literacy skills, when they're teaching phonics skills, even math, any subject. If I plot the child's audiogram on here, that lets them know that there's a struggle to hear, even if they have a mild hearing loss. And then what I'll do is I'll plot what their audiogram is with their hearing aids, and we use an S for sound field, and I can show them the difference. So if a student's not wearing their hearing aid in class one day, they're going to miss out on a lot. I also use this a lot with adults because they don't necessarily understand, when we describe the audiogram, they don't necessarily understand that. So this is a great tool to have in your toolbox if you're working in a school, you're working with a teacher, maybe there's not an audiologist there all the time. This is something that you can do. This is something that you can present to the teachers, to the principals, not just a classroom teacher, but phys ed, science, if kids go from class to class, all teachers need to be aware of this. The second one is called the SII, or the Count the Dots audiogram. And SII stands for the Speech Intelligibility Index. And so basically, each of these dots represents the importance of the speech sounds in that area. You'll notice that the shape of those dots kind of looks similar to the speech banana. But basically, again, you measure or you plot the audiogram, and then you count how many dots they have access to. So this person has single-sided deafness, so the right ear is within normal limits, and the right ear has access to all sounds. The left ear has access to none of the sounds, okay? And we seem to put a lot of emphasis on this good ear for people who have single-sided deafness, but having one ear that's completely impaired and one that's normal presents some pretty significant problems for the individual, especially kids in schools. The final one is a checklist, and this is the screening version of the hearing handicap inventory. We use this for older adults, usually 65 and up, and it just asks a couple of questions and the person answers yes, sometimes or no, and then we calculate the score and determine if we think that they're being affected by hearing loss. So these three tools are great tools that we can use. Audiologists use the SII for pre and post hearing aid fitting. It's not something that speech language pathologists would typically use, although it's not something you can't use. But the familiar sounds audiogram and the HHIE are both great tools. If you're working with kids, I would recommend using the familiar sounds audiogram, even with adults. But for older adults, this HHIE is a great tool to use. So then we need to think about, is hearing impairment or hearing loss, hard of hearing deafness, considered a disability? And really, I think that's up to individual people who may think that a person who is deaf or hard of hearing should be considered to have a disability and possibly receive monetary compensation. And there are people who believe that they don't. So it's really not about a set of beliefs. It's really about, does the person need it to access their everyday world? The International Classification of Functioning Disability and Health, which is a subsidiary of the World Health Organization, defines disability as an umbrella term, and that umbrella term covers impairments, limitations, and participation restrictions. Recognizing that a disability is a complex phenomenon, and that complex phenomenon reflects on the interactions between the features of a person's body that don't work and the features of the society in which he or she lives. They also describe a hearing-related disability as a loss of function imposed by a hearing loss, noting that the term is a multi-dimensional phenomenon. So it's not just one thing that denotes disability, but multiple things that denote a disability. They describe hearing impairment as a broad term that's used to describe the loss of hearing in one or both ears, and that there are different levels of hearing impairment. Hearing impairment refers to complete or partial loss of the ability to hear from one or both ears. And the level of the impairment can be mild, moderate, severe, or profound. So their definition of hearing impairment is much broader and includes a lot more than the definition of partial or total inability to hear that I gave you at the beginning. And it makes reference to one or both ears, and my definition does not. They characterize deafness as a complete loss of ability to hear from one or both ears. So they would refer to a person that is deaf in one ear or single-sided deafness as a person who is deaf. And this concludes the topic of hearing handicap.